Hello, my name is Ellen Veliz, and today I'm going to teach you guys how to perform the 7-site skinfold measurement test. To begin the test, a skinfold caliper is needed to take all measurements of the skinfold test. When examining the test, there are certain procedures that need to be followed when taking all tests of the skinfold. To begin with, all measurements should be made on the right side of the body with the client standing straight, upright. The client should be dry and free of lotion. Next, you should not take any measurements after exercise, and you should identify and mark all sites before measurements are taken during the test. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and index finger, perpendicular to the skin and halfway between the crest and base of the fold. The pin should always be maintained while reading the calipers. In between, wait 1 to 2 seconds before reading the calipers. Take duplicate measurements at each side to make sure the measurements are within 1 to 2 millimeters from each reading. Lastly, rotate through measurement sites to allow skin to regain normal texture and thickness. As mentioned, this is the 7 skinfold site test, so there are 7 areas that will be measured during the test. The 7 areas in the body that are going to be measured are going to be the chest, the mid-axillary, triceps, subscapular, abdomen, superiliac, and thigh. The first skinfold site that will be measured is the triceps. This is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. Next is the subscapular skinfold site. This is a diagonal fold at approximately 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. Next is the chest or pectoral skinfold site, which is also a diagonal fold. This measurement is different for men and women. First of all, 1/2 the distance between the anterior axillary line and the nipple should be measured for the men, and for women, 1/3 of the distance between the anterior axillary line and the nipple should be measured. The next skinfold site that will be measured is the abs or the abdominal. This is a vertical fold 2 centimeters to the right side of the umbilicus. Moving on a couple centimeters laterally, we have the superiliac skinfold site, which is a diagonal fold. This fold should be done at a 45-degree angle and should be 1 to 2 centimeters below the inferior angle of the scapula. The next measurement is the mid-axillary skinfold site. This is also a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. The last skinfold measured will be the thigh on the leg. This is lastly a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, which is also known as the hip. When you're finished measuring each site, make sure to go back and take another measurement of each site to find the average millimeters for each skinfold site. After taking each measurement of each skinfold site, there are 2 formulas that will be used to calculate body density. One is for men and the other is for women. In each equation, you're going to enter different values followed by your 7 skinfold measurements. After getting your body density measurements, there are 2 more equations that will help you convert your body density to body composition. These 2 equations are shown on the screen below and will help you get your total body fat percentage through your skinfold measurements. After finding your body composition of your skin folds, you will now be able to place yourself amongst others using this table shown below. This table works for people aged 20 all the way through 79 and gives you a basis of how good you are for your age group in body fat composition.